Hi, I'm Lindsey. I'm a clinical academic podiatrist. I'm now a consultant equivalent podiatrist working in primary care and associate professor based at the University of Southampton. Um, so at the start of my professional academic journey, I didn't think that I was particularly academic, but I was really curious and I was often asking, why are we doing the things that we're doing? Why does it have to be that way? And ultimately, that led me to successfully applying to take part in a research internship when I graduated as a podiatrist. And that was absolutely inspiring. I realised really early on through that internship that research is about curiosity and seeking improvement in all sorts of different forms. But I had trained to be a podiatrist and I was really keen to go into practice. And so off I went into practice, but I kept those links. And once that spark of curiosity was there, it couldn't be put out. And so I continued into practice. I observed lots of different challenges, and in particular, lower limb disease progression. And I saw lots of people who were living with pain, lots of unplanned hospitalization, lots of lower limb amputation, and lots of early death, and the impact of all those difficult things. And I was really driven to understand disease progression and the risk factors and what could we be doing differently or better. So over time, that evolved into a successful NIHR clinical academic doctorate, an NIHR postdoctorate award, and now into a research program that really is centered around translational research that improves personalized care for people living with lower limb long-term conditions, and really wanting to understand continually about disease and designing targeted interventions and transforming the workforce capability, and in particular thinking about service design. So the impact of the work now spans scientific understanding of lower limb disease to developing targeted personalised interventions and workforce models that really work in practice. There's a broader impact, which is about establishing new roles, developing new governance frameworks, and contributing to policy. And I'm really still driven by creating a space for future podiatrists or allied health professionals or the widest health and social care workforce to engage in research. So now I very much see my role as connecting research, workforce and implementation, for me, really, so that personalised lower limb care becomes much more achievable at scale.